A lot of people feel that they haven't had enough information with regards to my health records, and the government was going to have it for closure of it tomorrow. In this amendment, it gives the public more time to understand about my health records and what it means to them, which I think is very important. By allowing this extra length of time to the 31st of January does give the public a better understanding of it. And my understanding now is that the computer system to opt out has crashed. So it's not fair on the public unless we give them an extension of time. I just want to also why the extension of time, and I think it's very important that the people know what this means to them. Now, there's been a lot of fear about privacy and that people will access their records. My understanding of this is that the person has total control of their record at all times. Although there's an opt-out period now to the 31st of January next year, people can opt out of this at any time after that. At any time. The public are not committed to stay in this, they can opt out at any time. It is not retrospective and cannot capture historical information unless uploaded by individual or at individual's request by their own healthcare provider. The individual can also they will be able to log onto their own record at any time and see who has accessed that record. They can nominate who cannot access. And they can request destruction of the record at any time. And I believe that also the penalties that are associated with this, if anyone does disclose any health records, you've got a criminal offence of an individual of $63,000 and up to 5 years imprisonment, or if it's corporation of $315,000. If it is a civil offence, it is $315,000 to an individual, and for a corporation it's over $1.5 million. So my health record, I think, is going to be very good. And to put it on the record, I'm not going to opt out of it. I'm going to be part of it. And I think it's going to be very good for the Australian people, because a lot of people now travel around. You have the grey nomads, people travel around the country. Their records are going to be accessed by hospitals or doctors if they need to know what their situation is with health. And I think in general, I think it's going to be very good for the public. So I hope that this does get support from this House to allow the extension of time so the public are better informed about it, understand what it means to them, and I hope my amendment to extend it out to the 31st of January 2019 is supported by this House.
Pauline Hanson just exposed exactly why Australians were losing trust in the My Health record rollout. While the government was preparing to shut the opt-out window almost immediately, Hanson stood up in Parliament and pointed out something that should have embarrassed the entire system. Millions of Australians still did not properly understand what My Health record actually meant for their privacy, their medical information, and their control over personal data. And yet, the government was still ready to push ahead anyway. Then came the most unbelievable part. Hanson revealed that the opt-out computer system itself had reportedly crashed while Australians were trying to make their decision. Think about how ridiculous that is for a second. The government was telling people to either trust the system or leave it, but the very system needed to opt out was already failing under pressure. And somehow Australians were expected to believe this massive digital health database was completely under control. That is why Hanson demanded an extension until January 31st. Not to destroy the program, not to create panic, but to force the government to slow down and actually let the public understand what they were signing up for. Because, according to Hanson, people were terrified about privacy, terrified about who could access their records, and terrified the government was rushing this through before ordinary Australians had answers. And honestly, one of the most important moments in this entire speech was when Hanson admitted she herself would stay in the system. that completely destroyed the narrative that this was some wild anti-technology rant. She actually said she believed my health record could be useful, especially for Australians traveling around the country who may need hospitals or doctors to quickly access medical information in emergencies. But she also made it crystal clear that none of that matters if the public does not trust the process. Then Hanson started listing the penalties for misuse, and suddenly the scale of this entire issue became obvious. Up to 5 years imprisonment, massive fines for individuals and corporations, hundreds of thousands of dollars in penalties if records are improperly disclosed. Governments do not create punishments that severe unless they know the risks are serious. And that is exactly what Australians were worried about. The government wanted Australians to quietly accept one of the biggest digital health changes in the country's history, while people were still confused, suspicious, and struggling to even access the opt-out system itself. Hanson exposed the chaos in real time and forced Parliament to acknowledge what the public had been saying from the beginning. People needed more time, more transparency, and more control over their own medical data. And the fact this amendment even became necessary says everything about how badly this rollout was handled. Because if Australians truly felt informed and confident, the opt-out system would not have crashed. Privacy fears would not have exploded nationwide, and Parliament would not have been scrambling to extend the deadline at the last minute. Drop a comment and tell me this. Would you trust the government with your entire medical history after hearing this debate? Or was Pauline Hanson right to force an extension before Australians were pushed into the system?